and really enjoying the conference so far. Myself and colleagues here were just saying how just how wonderfully organized it is and how much there is to see. And although, of course, we'd rather be together, isn't it terrific that we can still come together in this way? So thanks for joining this session on awareness campaigns. We've got 5 speakers coming up, 5 different presentations, and we'll jump straight into it. After each session, we will take questions. So please use the chat box here to ask any questions you want, and we'll take the questions after each presentation. So our first speaker is from Ireland, Lisa Gernon. Lisa, you can load your presentation there now if you like. Lisa, I should say, is a colleague of mine, so I know Lisa well. And her presentation is about using advocates' voices to campaign for change, political change. She's a member of the communications team at the Alzheimer Society of Ireland. And I should have introduced myself as well. My name is Tina Leonard and I'm head of advocacy and public affairs at the Alzheimer Society of Ireland. So Lisa is going to present now about including the voices of people with dementia in political campaign in Ireland and how their voices are used to highlight the urgency of the need for investment. So Lisa, over to you.
I'm still asking, I'm still waiting, I'm still struggling. But why am I struggling? I was diagnosed in 2012 with Alzheimer's disease after a 5-year struggle of trying to get a diagnosis. And in 2013, I found my voice as an advocate working with the Alzheimer Society of Ireland. This has given me a sense of purpose. During the past 6 years, I have advocated relentlessly so that change will come. Maybe not for me, but for the 11 people diagnosed today, tomorrow, and the days thereafter. The reason I advocate is that I want them to see that I'm still the same person. I'm still Helen, and I want them to understand that we can have a quality of life. I have told my story so that people will grow in their understanding of what living with dementia is like, so that politicians will change policy, and so that people with dementia are supported from their diagnosis onwards. We want to live in our communities. We want to be loved and cherished as we were before. But I'm still waiting. I'm still asking, and I'm still struggling. Why? My voice has been heard on stages across Europe and globally. I've participated in many research projects, sit on boards, committees and steering groups. I've even received an honorary degree for which I'm most grateful. But what about the people with dementia whose voice is not heard? I tell my story because I still can. I want to be their voice. People with dementia have human rights the same as every other person, but the rights are not upheld. Why does our government not respect that? Well, it's now 2019, and I don't know how much longer I can keep asking, keep waiting, and keep struggling. There is one thing I do not have, and that is time.
Hi everybody, as Tina said, I'm Lisa Gernon. I'm the Communications Officer with the Alzheimer Society of Ireland, and what you just watched there was our tireless campaigner, Dr. Helen Rochford-Brennan, who recently just stepped down as the chair of the European Working Group of People with Dementia. Helen is also a member of the Irish Dementia Working Group, and in that video she explained why our pre-budget submission for 2020, why the message was that still asking, still waiting, still struggling. Now, Helen does so much work to raise awareness of dementia, to raise the profile of human rights for people with dementia. And the tone of that video came from years of lobbying the Irish government for ring-fence funding in dementia-specific care, and from the frustration that people living with dementia, they just keep feeling that they're being ignored. So what I would like to talk to you about today is how we used our advocates' voice to help bring about change, show what approach we took and how we used the assets that we had, and how you can actually make a real impact on a very, very small budget. Just a little water. Now, we've been lobbying for years and never getting anything. And in November 2018, sorry, excuse me, we held a National Emergency Dementia Summit. And this is us standing outside government buildings here in Dublin. This was after, once again, not getting anything in the budget. And we were just fed up. You know, the Minister for Health wasn't available to meet with us. Our advocates were angry, they were upset, they were frustrated. They felt they were ignored yet again. So we as an organisation felt that we had to do something. So that's when the tone changed for us. We wanted politicians to hear the real impact that this has on people's lives and how the issues could be addressed. So that change of tone really informed how we planned our pre-budget submission for 2020. So when we sat down as a team, you know, you could feel everybody was tired. We really needed to make impact. And we have worked with our advocates over the years to demonstrate the importance of this investment for people living with dementia. We've done videos, campaigns, photo shoots, newspaper articles have been written, radio interviews, TV appearances. And we just felt as an organisation that if nothing happened in the budget for 2020, that we'd need to make drastic changes. So we sat down to plan how we were going to make that impact on the government, but also on the public, because we needed them to get behind what we were trying to do. And for us, it was that change of tone. You know, we weren't going to be, asking that really nice way and then, sending out press releases expressing our disappointment yet again. This was a real opportunity for us to convey that message that's still asking, still waiting, still struggling, but we wanted to visualize it. So we really thought about what we wanted to do. And we actually had all the content. It was there on our desktops. It was on the walls in our offices. It was in the newspaper archives that we had. And our advocates have been asking for years for these investments. So what we wanted to do and what we had to do was just to present it in a different way, just to document those years of the asking, of the struggling. Now, we had a very small budget, but we managed to make 3 videos. You saw Dr. Helen Rochford-Brennan. We also worked with our dementia advocate, Katrine, and then we also worked with our care advocate, Sean Donal O'Shea. So what we did, right, everybody on the team, they selected images of different events that they'd been to over the years, articles that were involved with, TV appearances, quotes that impacted them over the years. We sat with Helen, with Kathy, with Sean Donal. They gave us images that were really important to them. Those images then inspired the words of the scripts that we wrote. And we printed out all the pictures and we put them all over our office floor. God, I remember what it was like to be in an office. And looking at those pictures, we read out the scripts out loud and we matched the pictures to give the best impact. And then I actually drove to our advocates' homes in different parts of the country. We have a Canon camera that we had purchased a couple of years ago. I used that to film with them. That was a big learning curve and we learned a lot together, we did. But the only cost really for us was to get an editor to actually put the video together for us because we needed to really get that impact across. And if you'd like to see Kathy or Sean Donal's videos, you can go to our YouTube channel. It's the Alzheimer Society of Ireland. So 2020, our budget asked, we wanted 18.4 million in community supports and home care for people with dementia. So we launched our pre-budget submission on the 3rd of July. Helen's video was played for all the attendees there. Helen herself actually spoke, and we had the highest ever attendance of political representatives for that particular day. Now, our first pre-budget submission was back in 2010, so this was 10 years of work. And 58 politicians on the day signed the pledge to lobby the government for a minimum level of dementia supports in every county across Ireland. But we needed the momentum to keep going all through the summer. So those 3 videos that we made, we shared them all across our social media channels with our staff, with our e-campaigners, and we had a call to action. And that call to action was, we wanted them to send this letter to their TD, asking them to support the asks in our pre-budget submission. So those videos were shared, with the public that engaged with us already on our social media platforms, people that hadn't, the e-campaigners list that we've built up over the years, and to our own staff as well in internal and external messaging. We needed this letter to be sent. We also had a call to action for politicians that we wanted them to pledge to lobby for dementia support. So we used those really powerful messages in the video to drive that, the lived experience of people living with dementia and their carers. Now, here's just a little snapshot of some of the comments that we received. You can see there, truly amazing, inspiring lady, powerful video, powerful words, you know, Helen as a voice for the voicelessness. This person says that they've written to our Taoiseach. You know, people are acknowledging that more supports are needed at home, you know, encouraging, you know, our advocates for sharing their stories. Sorry, I get very emotional sometimes. You know, the videos, they really had impact. So those messages, they're so powerful, and people couldn't ignore them. So we reached over 70,000 people across all our social media channels with those videos. And we had a really small budget to put behind the videos. We spent a couple of euros just to boost the videos, so it allowed us to reach more people. So, you know, when you're thinking about your budgets and stuff, keep a few quid just to be able to boost those videos slightly. You know, this resulted in over 5,000 letters being sent to politicians all across the country, and over 70 politicians pledged to lobby for dementia supports. We also had a lot of media coverage. We were lucky enough to get on our national broadcaster. We were on local radio, we were on national radio, we were in local print, national print. And it's also really important to note that, you know, there was a lot of political lobbying going on behind the scenes also. But all this work that we've done, you know, we still didn't know if this was going to make a difference come budget day. So we just had to wait and see. 8th of October 2019, budget 2020, our finance minister, Pascal Donoghue, stepped up to the podium. You know, we all sat around, we listened, we jotted down things that he said. You know, there's so much to digest on budget day. But then he said that we'd be funding for 10 more dementia advisors. And it was one of those moments where you're like, did I actually hear that correctly? But yes, we did. And funding was allocated for 10 more dementia advisors and 1 million additional home care hours. Now, it wasn't clear to us how they were going to be appointed, when it was going to happen, who was going to do it. But for us, this was a small step in dealing with, you know, all the things that we'd identified and the supports and services that people living with dementia and their families needed. So what we did was we identified and asked that people could really relate to, because a dementia advisor is such an important resource for the community. They work with people with dementia, their families, their carers, to provide information and to signpost to other services that are available out there. So we got political support for dementia advisors in 2019, but we've had continued investment since then. We've grown the number of dementia advisors from 8 to 28 in a year. We've had the highest level of political support from our Department of Health and from our ministers. But, you know, why did it work this time? And I want us to just think back to the video and hearing Helen saying that, still asking, you know, that's still waiting, still struggling. That had an impact. You know, we had that really strong message. Sorry, I get so emotional. We had a really strong message, a really simple ask, and then we had the voice of the people who are directly affected by dementia. Sorry. So to recap and to compose myself, really think about using your advocate's voice to bring about change. You know, people watched the lived experience. They heard Helen, they heard Kathy, they heard Sean Donald, you know, like, and take a minute to think about, you know, the material that you have and how you can use it to inform your messaging. And then just, you know, the impact you can make on a small budget. Just think about what money you have and how best to use it, because you really, really can make that impact. I'm so sorry. Thank you. That's it.
Thank you very much, Lisa. And,
I'm so sorry for getting so emotional.
That's quite all right. I think, well, Avril, another colleague actually in the chat box, has just said your passion for your work is amazing, and the people you work for and work with will always appreciate that. And it's okay, it's absolutely okay, isn't it, to be emotional? And it's what comes from working with wonderful people who are telling the stories of their lives and it making a difference. So I wanted to ask you, I mean, I don't see any questions in the chat box. Carmel D'Amato there has just said, keep up the good work, Lisa. So, and Kira O'Reilly said, that was amazing, Lisa, well done. But a question for you, Lisa, the advocacy and making change politically takes a long time. And you demonstrated that. You said this had been going on for years. So I'm wondering, when you involve advocates, when you involve people who are giving of themselves, they're telling their own personal story, and that can be difficult for them. How do you manage their expectations? What if nothing happens and they're disappointed? How do you manage their expectations when involving people who are vulnerable?
Yeah, no, absolutely. And I suppose before we sit down to plan what it is that we want to do, we have to really consider that as well, because you do have to manage expectations. And our advocates trust us with allowing us to tell their story. You know, as somebody mentioned there, that Helen is a voice for the voicelessness. Like, our advocates know that there's people out there that don't have a voice, and that's why they do it. You know, we set out from the start with goals as to what we want to achieve, but if we don't achieve them, we know that each little piece of work is a step towards what we want to do. And I think when we decided to do those videos, when we spoke to our advocates, that's what we talked to them about. We're like, look at all the work that you've done over the years. We're going to put it all together. We're going to show, and hopefully, you know, this year there will be a change. But if there isn't, know that what you've done this year, we will use it again next year. All the work, it doesn't end, it's continuous. And that's I suppose that's a way of managing expectations, because, you know, there has been many disappointments over the year. But, you know, once you go in with that, you know, this is what we're trying to do. If we don't achieve it, we'll use it again to continue to try and get that ultimate goal of those dementia supports and services. You know, and we're really lucky with the advocates that we work with, because they trust us, you know, and we make sure that they are supported from start to finish. And finish could be 6 months after an announcement. You know, we're always there to make sure that they're okay with what they're doing. And at any point, if they decide they don't want to do it, that's perfectly fine too.
Okay, thanks, Lisa. Yeah, that ongoing communication and understanding is important. A quick question and very quick answer, if that's okay, from Laura Orton. She'd like to know, do you have an in-house creative team, graphic design or motion, video? If not, what stage do you get people involved in your campaign? I can answer the first part. We don't have those resources.
We don't. We have 1.5. Well, we actually just, there's 2.5 of us. I work part-time. But what we've done is, you know, we've invested in ourselves as well. And we've learned how to, you know, shoot some stuff, we've looked at different packages for videos to do various things. And with that video, as I said, I went out and shot it. We wrote the scripts, we did all that, but we knew we needed to pay an editor to make sure that we could get that impact across. But since we've done that, we ourselves have learned how to do some editing, and we've created new videos ourselves. So it is possible. You just need practice. Practice. But think about the money that you have and where you want to put it. You know, maybe not getting somebody to film it for you, but somebody to edit it for you. Just think really, you know, cleverly as how you want to use the money.
That's good advice. If money is limited, there's some things we can all learn and do for ourselves, but there's some point where professionalism is important, and editing can provide impact. Very good. Okay, Lisa, thank you very much for that presentation, and thank you for all the comments coming into the chat box as well. We're going to move on to the next presentation now. And this is from Katrine van den Bos, and Katrine is from the Danish Alzheimer's Association. She's in charge of the Danish Dementia Friends initiative there. They've been part of the Dementia Friends program since it launched in 2015. And now this presentation is going to describe the collaboration with the Danish retail chain. It's a big supermarket chain, I believe, REMA 1000, and about their work together to raise awareness about dementia among the employees and customers. So this is a pre-recorded video, if you could roll that, please.
Good afternoon. My name is Katrine van den Bos, and I work at the Danish Alzheimer Association. I'm in charge of the Dementia Friends initiative called Dementia. I've been working with the Dementia Friends initiative since its launch back in 2015. We have currently more than 110,000 dementia friends here in Denmark. Today, I'm going to talk to you about our partnership with the supermarket chain REMA 1000 and how we are increasing awareness about dementia amongst its employees and customers. But first, I would like to give you some background on the partnership. It all started back in 2016, when two dementia health professionals who were also dementia friends took contact to their local REMA. They knew that a person with dementia did her daily shopping there, but it was becoming a challenge for her, for example, to find her way around the store. They held an information session for the staff and gave general advice on how to communicate with people with dementia. The staff were positive about the session and thought it was very useful. The store was actually later named the first dementia-friendly supermarket in Denmark, with a lot of local press coverage. At the Alzheimer Association, we saw this as an opportunity to reach out to the headquarters about a possible national partnership. After a dialogue with the management at REMA, a partnership was announced with the aim of spreading the initiative to all of REMA's 300 stores and reaching around 14,000 employees. So how did we go about doing this? When we launched the partnership back in 2016, we had 3 learning videos produced with typical situations that might occur in a supermarket setting if you have dementia. The videos were filmed with a REMA 1000 employee, actually one from the first dementia-friendly supermarket store, and with actors, of course. We also delivered a guide with 7 good ways to communicate and how to see if a person might have dementia. Moreover, we delivered content to REMA's online learning platform so that employees could complete a learning session on dementia. All stores received a package with Dementia Friends badges and information folders for all employees, and a sticker to show awareness about the initiative. REMA 1000 uses Workplace. It's kind of Facebook for companies. To communicate to all their employees. Since November 2018, Dementia Friends have a group where we can create posts on dementia and also follow the commentary and interact with the employees. All employees are automatically assigned to this group. Last year, we asked in the group on Workplace if any of the employees had examples to share about dementia and if they were ready to be interviewed about it. We selected 5 stores and our journalist intern Emilia went on a Denmark tour to document the partnership. I would now like to show you one of the videos that we made. It's about the cashier Susan and how she helped a couple where the husband has dementia. And now the video is coming.
Jeg kender Marianne igennem hendes mand. Det var faktisk hendes mand, jeg kendte først. Fordi han var fast kunde hernede. Han kom meget alene, og så var det sådan rent tilfældigt en dag, at jeg så, at de var sammen. Og så den vej igennem, da han begyndte at blive mere og mere ikke som han plejer, så fik jeg så kontakt til Marianne. Ja. 4 gange.
Det var jo en tryghed, fordi at jeg vidste, at i den anden ende var sus, og det kunne aldrig gå helt galt. Han prøvede at scanne 100 kronesedler, og til sidst gik han bare ind og tog varerne og gik hjem.
Jeg lod ham faktisk bare gå, så jeg behøver ikke at sætte ham i den situation, hvor han bliver gal, fordi at han fik lov til at gå, og så ringede jeg til Marianne og sagde, der er varer, der skal betales, og så kommer du, når det passer dig.
Der var en meget stor vilje til at rumme ham, når han kom, og forklare tingene dækkeligt over ham, så folk ikke sådan synes, det her det var virkelig, virkelig mærkeligt. For det handlede også meget om hans selvrespekt på en eller anden måde. Han skulle ikke gøres til grin sådan i det offentlige rum, så det var en meget stor hjælp.
det var faktisk for at få den her, for ligesom at vise, at vi er opmærksomme på det i butikken.
Der skal meget mere åbenhed, opmærksomhed, fordi der er mange, der sådan bare tænker, der kommer en her, der ikke er rigtig klog. Og det er rigtig vigtigt, at vi ved, at de færdes rundt omkring. Og på en eller anden måde måske også blive klar over, hvad kan vi gøre for at hjælpe dem.
Yes, I hope you enjoyed the video. I think it's a great example of an extraordinary person and how she shows what she has learned as a dementia friend. Susan was just one of the 5 examples that we chose to interview about how they've been using their knowledge on dementia in practice. All the other stories dealt with different themes. It was, for example, of how to handle difficult situations occurring between staff and people with dementia. Maybe sometimes the staff hadn't reached the training already and didn't understand why a person might react in a certain way. Also, it was making sure that new staff members would become dementia friends, and also addressing it from the beginning that in our store we are working with as dementia friends, and that it's important to learn about dementia. The employees also gave advice on how they felt best it was to communicate with people with dementia, and it was especially noticed that you shouldn't be afraid to offer your help if you notice someone that is looking like they have difficulties finding their way or finding their way to the groceries in the store. But it also revealed a personal aspect. The man you see sitting in the couch told us that the partnership and the Dementia Friends group on workplace had actually meant for him that it was easier for him to be open about his mother's dementia disease, and that he felt he could talk openly about it with his co-workers. It was thought as an internal campaign on workplace to share best practice and to pay tribute to those employees who are working with spreading Dementia Friends in their local store. But we made sure from the beginning to get permission to share the videos and interviews externally as well. And now I would like to show you how some of the content have been received by the external audience. I guess you recognize the 2 ladies on the slide. Here we have Susan and Marianne again, because every year we encourage our dementia friends to nominate a person who has done something outstanding for people with dementia. This year, Susan was nominated, and this was actually before we shared the stories from REMA with our dementia friends audience. She won for her outstanding service and way of meeting people with dementia, as you have just seen in the video. We filmed the surprise announcement at the store where she works, and that video got shared on Facebook, and it got more than 250,000 views and around 1,900 likes on Facebook. Afterwards, we released the video we created for the internal REMA campaign with the story about how Susan has helped Marianne and her husband. And that video got almost 300,000 views and almost 3,000 likes on Facebook. They are the 2 most important, they are the 2 most shared and commented posts in so far this year on our Dementia Friends Facebook page. So we are really happy about the opportunity to use the content that we created internally for REMA, also externally, in a way to also increase the awareness of the partnership, but also about the importance of being a dementia friend. Last, I would like to sum up my talk with giving you 5 lessons from the partnership. Always very important to ask the employees. Check if the advice and guides that you are giving them are really what they need. Ask for their feedback. Also just to have confirmed that it is the right advice in the first place. Involve them in making the material. The best advice always comes from a colleague. It's very strong if we can have the REMA employees telling their colleagues how to go about dementia, and also why it's important to learn about dementia. Also embark on this path where a lot of people have a personal relation to dementia. The pictures you see here on the slide are actually from our annual collection day, where we ask for donation. Normally, we would encourage the REMA stores to take part by ordering a collection tin. But this year, we saw that many of the employees through Workplace signed up as to be part of it themselves and collect money outside the store. It really connected people, and they started to share personal stories on Workplace about how they themselves were affected by dementia in their family. So this is definitely something we are going to have more focus on in the future, how to create this sense of community where we unite together against dementia. Also, the importance to collect best practice and get these ambassadors also to share the content is really important. Keep it simple. Workplace is just like Facebook. It's a constant battle for attention. So keep your messages very simple and down to the point. And we have learned that video content is especially suitable for this type of audience. We are really proud of our partnership with REMA 1000, and we look forward to activate more REMA voices to tell about dementia in the future. It really has created great stories and made a difference in how we communicate about the importance of being a dementia friend through your workplace. I would like to take the opportunity to thank you for your attention, and you are now welcome to ask me any questions you might have about the partnership. You are also always welcome to write me an email if you want to hear more about the partnership. Thank you so much for your attention, and have a lovely conference.
Oh, thank you, Katrine. That was such an interesting project, and that's reflected in the messages coming into the chat box, with people saying they're impressed. It tackles stigma, a wonderful initiative. And the positive impact it has on the person with dementia. I'm very interested in the fact that you documented everything as it went along, and then you were able at the end to also bring people in through using an award and a reward. So I'm wondering how important it is to document everything as it goes along, to collect these stories as you go along. Was that really important?
That's at least something that we have noticed that it is for this particular partnership, because REMA, it is supermarket employees. It's really important to activate their own voices in terms of also creating your audience there on Workplace, because we are battling for the attention of many other things. And of course, dementia is not the only cause that REMA is supporting. So it's also trying to make our partnership give that more attention to the employees. And then we noticed that we had few emails coming in with questions from local stores about how do we handle this particular situation, or we are experiencing this and that. So we also wanted to test if these guides that we have been distributing to employees, actually, how was that received? Was it the right advice? So it was also to sort of to get an idea of how does this material actually live out in the store. And we had then this opportunity with our journalist intern, that she could go out and document this as part of her internship. So that was also the first time that we tried to do this, but it's definitely not the last time, because we can really see that these videos are really strong, and it makes the partnership come much more alive also to our members and our whole audience also outside the partnership.
Yeah, we're seeing from your presentation, Katrine and Lisa, ahead how important content is, and videos really are the way to go now, aren't they, too? And I love the idea of the badge in the supermarket must be very visual, a very visible act of support for people with dementia in the store. Did you get feedback on the importance of badges that the supermarket staff wear?
Yeah, that's then some of the next steps we were going to take in the campaign. Is then now we've been focusing more on the employee engagement, but now we are also going to look more at the internal side of it. So actually, how is this partnership received from our members? Are they using the badges? Are they also recognizing the picture locally in terms of the partnership with the supermarket chain? Because that can also create an effect of them helping us to give a friendly reminder to the staff that it's important that they get knowledge on dementia.
Okay, very good. And just a comment here. Somebody has asked, Jane has asked, she loves the videos, but wouldn't it be great if people with dementia were used instead of actors?
Oh, the video was it's a real video. I guess I wasn't clear on that. The videos with actors are the learning videos. So that was just in terms of, that was the advice we got from the film makers. But I think there is a fair point in also having videos seeking that kind of content where it's people with dementia telling about how is it for me to go shopping in this store, and we are also looking for those cases. We just didn't have them at hand for this first round of the project, but that would be even stronger if we of course can have it directly for them.
Absolutely, yeah, it's a next step for all of us, you know, including as we heard earlier, including that voice is very powerful, and it's great. You're showing real stories here, so you're already doing that. Carmel in Malta said they're planning something similar there, which sounds great. And the last question from Katrine Bernatech, they're asking for a link to watch the video again. Where would we find that?
I can provide it maybe to the organizers, because it's just something I had made with the subtitles for this presentation, but we are happy to share it with the text. I can figure out a way to do that. Okay,
thank you very much, Katrina, and thank you for everybody for your comments and questions. Such an interesting project to learn about, and best of luck with the next stages. Maybe next year we'll hear about what happened next and how it progresses, because this sounds like an ongoing relationship.
Yes, we hope very much. Yeah.
Good, thank you so much. So from Denmark, we're going to move to France next, and our next speaker is Lorène Gilly from France Alzheimer. And this presentation, it's a pre-recorded one also, is all about a campaign that was launched in World Alzheimer Month last year, involving awareness raising, broadcasting, and a pledge as well. So it's a national campaign, and if you can roll the video now, let's hear this. Thank you.
Hello everyone, I'm Lorène Gilly from France Alzheimer and Related Disease, and today I'm here to talk to you about our 2019 national campaign, Building an Inclusive Society. So in 2019, for World Alzheimer Day, France Alzheimer chose to focus its message on inclusiveness and the necessity for all citizens to take into consideration people living with dementia and their families. As you can see on the poster right here, one of the main messages, understanding me is helping me to always enjoy the city. Our main objectives with this campaign are to raise awareness among society and among all the actors of the everyday life, and to dismantle stigmas around the disease and its consequences. So this campaign has been built around 3 main axes, and it has been designed to last long after World Alzheimer Day. And the first axe of this campaign, you can see it also behind me. It is a unifying symbol of recognitions to signal our support for people living with dementia and their families. Since we began to broadcast it last year, it appeared to be a useful tool to spread awareness and the necessity for all citizens to show more support on a daily basis to people living with dementia and their family. The second axe of this campaign is a pledge a pledge we called Alzheimer Caring Governments to engage mayors and local governments in an inclusive approach with our 99 local organizations. So thanks to their work, since last year, we have signed almost 300 pledges, and we are still signing pledge today and hope to sign as many pledges as possible to make the city a better place and a safer place for people living with dementia and their caregivers. So by signing this pledge, mayors and local governments engage themselves in an active approach to facilitate in concrete terms the everyday life of people living with dementia and their families among their local communities. So, for examples, the actions taken by mayors and local governments can be to make sure to facilitate the access to relevant informations, to facilitate transport arrangements, to build a local training program with our local branches, training program for local businesses, bus drivers, artisans, so to understand that, to make sure that they understand better the disease and the way they can facilitate the everyday life of people living with dementia and their families. But it can also be to facilitate the deployment of memory cafes in the cities, and of course working with our local branches to raise awareness in their community. The third axe of this campaign is raising awareness and training the major national stakeholders such as policemen, fire departments, railway operators, and we are also doing this with the help of our 99 local organizations. And it appeared essential to us that these actors are able to recognize, appease, and support people living with dementia in their daily activities. And so this specific acts of the campaign has also led us to sign multiple partnerships with national federations, such as sports federations, horse riding federations, a police department federation also. And so we are working with all these national federations to develop specific programs, training programs, and to make sure that more and more people are aware of the disease, its consequences, and the way we can all facilitate the everyday life of people living with dementia and their families. And more recently, we have also worked with a French association to explain the disease to the little ones. And so we created this little book with them, and it's a useful tool to spread awareness in the schools also. And with this campaign, and we truly believe that with the active support of all citizens, professionals, public authorities also, we can all build a more inclusive society for people living with dementia and their caregivers. Thank you very much. If you have any questions, I will be pleased to answer. Thank you.
Thank you, Lorène. That is a huge project. My goodness, the amount. I mean, this is really incredible. You know, involving all of those mayors and cities and all the different partners. Maybe we'll get to that in a minute. But I want to ask you. There's a question there from Laura Orton, similar to one before. Practical question: at what stage in the campaign did the creative professionals become involved, designers and so on? Were they brought in from the outset, or later on? And she also has a comment saying that poster looks like a film poster, which it did. It was like a French film poster. So tell us about that practical aspect.
Yes, well, thank you very much. I am really pleased to be here with everybody, and thank you for the first presentations. And it is a lot of inspiration too. Creatives were engaged in the project for the symbol part and the video, because we indeed had a video also, but we didn't have the time to create the subtitles, so unfortunately I can't show it to you today, but they were involved in the project quite at the beginning, and for the pledge and the training, the process is still on. So now we are on our own to make sure we sign more pledge and involve more partners with us in this project.
Thank you, Lorène. And from Carmel, she's asking, she's saying, is it like having a dementia-friendly community, like a dementia-friendly village? Is it the same idea?
Yes, well, it's the idea really is to involve more and more people, actors of the everyday life, from like we saw in the last presentation, the cashier in a shop, the policeman, the bus driver, the mayor, the public authorities, to involve everyone and to make sure that everyone show kindness, recognize people with dementia and their caregivers, recognize their needs, and make sure that people with dementia and their caregivers they can still enjoy the city with serenity, and they can meet humanity and kindness every day.
Yeah, well said and well needed. I'm thinking with the mayors, with the cities and local governments that have signed pledges, and you described the different things that they're doing, information, training, accessibility, and so on. Do you have a lot of colleagues working with them to make sure they are doing this? I was wondering that, and it links to a question Jane Ward is asking there. Where does the funding come from? Because it sounds like a big project.
Yes, it is a big project, but in fact, it came from something that already exists. I mean, we have 99 local organizations over the national territory, and some of them had already great links with the local authorities and help from the local authorities. So the idea of this pledge was to enhance more mayors and local governments signing there and making sure they can work with our local branches and our colleagues on the field to implement activities, actions, make sure they make informations available for everyone. So yes, it already exists, and in fact it needs involvement of the people on the field, but at not so much cost, in fact.
Okay, yeah. Well, that's so interesting. I mean, there must have been some cost, but what you're saying is that the main effort was bringing people together from all the different parts. It's exactly people's time. Okay, that's really interesting. Thank you so much, Lorène. We'll have to. Yeah, we'll have to leave that there. Even though all of these are so interesting, And what I want to say also, a shout out to Susan Whitmarsh and Hadas, I can't see your surname, Hadas. They say that this is their favorite breakout live session. And they think there's lots of positive comments coming in about about all the presentations. So Susan and Hadas, you're our favorite participants. Thank you very much. But we've two more great presentations to come. We're running a few minutes late, but stay with us because it's good. So let's see where we're going to next. Well, we're going to the Netherlands and Philip Scheltens. He's from the Alzheimer Center, University Medical Center in the Netherlands. And this is about convincing the public that time really does matter in terms of brain health. Philip is going to describe to us a multidisciplinary group that was put together to make recommendations, including recommendations about health promotion. So Philip, if you could present now, please.
Yep. So thank you very much, Tina, and all the others. It was already really inspiring. And this will basically cover a little bit of another side of the coin. I think from us as researchers, as clinicians, and also policymakers, we also have to do some work in raising awareness and pointing to some of the facts that we probably have not paid attention to in the past that well. So I will do this on behalf of a lot of additional authors, as you can see here. I won't go into all of them, but it's also a mix of people who are involved in dementia, but also more in general in neurodegenerative diseases, like Professor John Hardy and also Professor Alistair Noyes, who's actually a Parkinson expert. So the presentation is all about brain health, but it actually is a bit further and beyond only dementia. So just to make very clear, why would time matter? And time in different sort of meanings. We think it's very important to raise public awareness, as you all have done in the past presentations as well. And one of the things that we have to sort of saying to all of them, and I think to everybody involved, and especially also to physicians, is that dementia is not just an inevitable part of aging. We know that dementia, several forms of dementia can occur at earlier age as well. So it's just not sufficient to say, well, if you grow old, you will be demented anyhow. This is really not true. And recognizing that it is a disease, it's actually a start. For many of you listening, this may be an open door, as we say in the Netherlands, but a lot of people are still not convinced. Another thing we have to raise awareness of, that risk factors that are modifiable can actually affect brain health. And brain health we talk about when the brain is not yet diseased, when no disease has entered the brain yet. To keep it as healthy as possible, there are a lot of things you can do by yourself. Also, time is of the essence in terms of diagnostic development, developing biomarkers that will help to diagnose dementia or the underlying cause of dementia, I must say, as early as possible. Time as a window of opportunity, as long as you are in your 50s, 60s, before the age that the prevalence of dementia really starts to raise, you can actually do something. And doing something to de-risk your neurodegenerative disease is really of the essence. Oh, sorry. So we have put together a large group of people, as you saw, and we have created a report in which we have given some evidence-based recommendations and a call to action, encouraging positive behavioral change and policies to promote brain health, working towards prevention of neurodegenerative disease. And they're basically threefold. It's promoting general health, promoting sort of awareness among clinicians and things that you can do clinically, and of course, promoting a research agenda to facilitate this. So health promotion recommendations in the report you can summarize, is one sort of overriding message is that what is good for your heart is also good for your brain. that's maybe, again, an open door, but it's not understood by everybody. So people have a lot of attention for blood pressure because they think it can actually decrease the risk of a heart failure or heart attack, but it's actually also very good for your brain. So in order to expand that sort of preventive measures then in general health, and to make it clear that this is also good to prevent dementia, prevent Alzheimer's disease, this is very, very important. So that would be another incentive to protect and provide increasing health budgets to stress this message, but also to improve the behavior of people, to improve the brain health, and saying, well, what you're doing now is sort of lowering your weight, for instance, or keeping track of your blood pressure is also good for your brain and maybe preventive for dementia. People around in the world are looking for risk factors that they can sort of mediate or can do something about, and some people actually go for commercial genetic testings, for instance, for ApoE4. That is all fine. I mean, you can't stop that, but then the healthcare system should be able to help people when there are questions arising from this genetic testing. And of course, provide access to available and effective treatments. Now, this may not be important nowadays, but in a few years, things will change dramatically, I can say you. If, for instance, aducanumab will be allowed on the market, the healthcare system needs to be prepared to take on this challenge. And it will be a challenge, I can tell you. So clinical recommendations to healthcare professionals and administrators, being in charge of hospitals, they are really very important in the management of people with a risk or for a neurodegenerative disease, and should act on what we think are the two most important clinical recommendations, that as soon as there is a suspicion of cognitive decline or incipient dementia, please refer to somebody who has knowledge on this. It may be a specialist, it may be multidisciplinary services, it may actually be also the GP, but somebody has to take care of this, and somebody needs to have special attention and knowledge about dementia in general or neurodegenerative diseases. So make that sort of barrier very low to increase referrals to specialized services, and also provide follow-up with ongoing, widely accessible holistic care, including prevention, information, treatment options, and support. Again, be prepared that people nowadays will be more and more inclined to seek help when they perceive symptoms that they may actually think that this will be the prodrome of dementia. So healthcare systems need to be prepared to take on this challenge. For researchers like myself, of course, and funders, of course, as well, it's extremely important to focus on neurodegeneration. You probably know that the budget for research into dementia in general and neurodegeneration in general is 30 times lower than that in oncology or HIV, for instance, still. And that's so sort of strange when you realize that the amount of people that suffer from this disease is actually the same as people with oncology. So we have to really sort of boost the amount of funding, and we as researchers have to really boost also the development of new treatments. For this, you need validated diagnostic tools to identify people at risk as early as possible. Facilitate early disease detection and intervention, of course, that's a little bit the same. And for this, additional funding is needed. For the priority in research goals, we think that effectiveness and cost effectiveness of interventions to promote brain health. So for instance, sort of promoting blood pressure checkups, diabetes checkups, even sort of weight loss and that sort of thing is really important to identify and to make it as effective as possible. So understand how people with risk factors for a neurodegenerative disease may motivate to change their behavior. How do you do this? We have to research that as well. And what we do not know is how all these risk factors, and there are 7, 8 to 9 risk factors already that we know are important, but how are they weighed? Is there one that is really more important than the other one? And where do you start? So we think brain health is very important. I think what you see happening is already that memory clinics are changing their formula and changing their attitude and not focusing on disease, but focusing on promoting brain health to prevent disease. We think there is a window of opportunity there. The public understanding is generally poor. People know what is good for your heart, but not what is good for your brain. And the healthcare systems, as I said earlier, are not equipped to manage all these, the large amount of people that actually should seek advice on brain health. Again, so here is sort of the risk factors in general that people need to know about, and you can split them up into genetic factors. Of course, I mentioned ApoE, but there are actually 35 other genetic factors that are important. Education, how important education in fact is, that needs to be told as well. Of course, lifestyle factors, smoking, diet, overweight, physical inactivity, social isolation, extremely important to get that message across. But also environmental factors, pesticides, especially important for the occurrence of Parkinson's disease, for instance, but also heavy metals and toxins that have been associated with Alzheimer's disease. Poor hearing, heart disease, diabetes, stroke itself, traumatic brain injury, playing football and heading the ball, etc., hypertension. Extremely important to know about these risk factors. So, do people know? Well, this was a query that Alzheimer's Research UK actually set out, and they asked people, do you know whether risk factors are important to prevent dementia? Well, a lot of people know this about diabetes, about heart disease and stroke and cancer, but only a third of the people thought that it would be possible to reduce the risk of developing dementia by doing something about lifestyle. And of course, for us and in the healthcare system, communicating risk is also important. The more we work with biomarkers, the more now we work with blood biomarkers, they give you an impression about the risk for incipient Alzheimer's disease, for instance. And how about the risk when you know you are ApoE4 positive? You have to be able to communicate this risk to people that seek your help. And we have to do research on how to best do this. And we also help train people to do this, because I think training and communication of healthcare providers with people seeking their help is extremely important. So to conclude, we think a collaborative effort is needed to achieve common goals. The behavior change is that everybody needs to prioritize their brain health to implement behavior that reduce the risk eventually of dementia. And as you know, every year that you delay the onset of dementia is a gain, an enormous gain in many ways. To educate policymakers, but also public health bodies and health professionals, that's really an important goal for us also to achieve in the near future. And of course, research to validate the diagnostic tools, to get better treatments, and to also sort of work out how the healthcare system should be changed in order to sort of help the advanced need. So these are just some acknowledgements and disclosures, and I think I will end here. Thank you very much.
Thank you, Philip. Thank you very much. I think it's a good reminder, isn't it, about for all of us, about the different types of messages that we do need to get out. And you know, we concentrate a lot on living with dementia and community and interaction, but people's understanding, as you say, of the risk reduction factors and how heart health is linked to brain is quite poor. So I'm wondering, first of all, to people watching now, to members of the audience, how many people here, type yes or no in the chat box. Has there been a campaign on brain health in your country? I'd love to know that. Just type yes or no and we'll see how many. And Philip, for you, mentioning there that yes, that heart health is also good for the brain. Do you think there's a room to mix those messages? So did it come from your research, any information as to whether there should be one separately on brain, or whether you could add those messages to existing campaigns on heart health, for example?
I think you should basically mix them. I think it's not very wise to have sort of different messages, and because all in all, they're basically all the same risk factors, and I think it should be generalized. But also in our country, in the Netherlands, we have a large prevention program, but it's all about stopping smoking, etc., because of cancer and heart disease. But they haven't made the link actually that it's also good to prevent dementia in the long term. And just making that link and just making it very clear that it is actually good for many more things than only the heart is already something to sort of to be gained. Yeah, that's a really very good point, that education really needs to happen. And if there's an opportunity in other campaigns already ongoing or in special dementia specific ones, that's all okay, isn't it? As long as the message is getting through. Yeah, well, it's interesting. And we all like to think in silos. When you are in the dementia researchers like myself, you focus on dementia. But in fact, what happens in Parkinson's disease and happens in heart disease is basically, and even in oncology, it's all about healthy diet, healthy lifestyle, sort of promoting better sort of care in general. And that's things that we have in common. And actually, we should work together in order to get that message across. Thank you, Philip. There's a good challenge to those of us from Alzheimer's associations here to work with people in other health sectors as well, to join in on the messaging. We got lots of responses. The question I asked to you there, all of you watching and listening, there are some yeses and some nos. This was the question: has there been campaigns on brain health in your country? Now, I didn't. Somebody, Annette has said, when you respond, could you give your country? I didn't ask that. Apologies. So I don't know what countries are yes or no, but there's quite a few yeses and nos. It's almost, I haven't counted it, but it's almost evenly spread, I think. And people are agreeing that education is the key. And Marco from Alzheimer Netherlands is saying there's been no campaign in the Netherlands, and in the new strategy announced on World Alzheimer Day, there's no budget for such a campaign. So of course budget comes into it too. And Marina in Malta is saying that they have a national dementia strategy, but they really do significantly lack on promotion and awareness campaigns. No campaign in Cyprus, no campaign in Malta. People are mentioning their countries there. So mixed, I think, and I suppose let's say again what you mentioned there, Philip, that if there isn't a budget or if there isn't a specific campaign for dementia, see if there can be some links made in other areas as well, just to start the awareness of this area. Yeah. Okay, thank you very much, Philip. And we're going to stay in the Netherlands now for the last presentation of the session. And thank you all for staying with us. So this presentation now is from Mignon, Schichel. And it's about age-friendly policies in a cross-national or cross-border setting. Mignon is a researcher at Alzheimer Center Limburg of Maastricht University, and her research interest lies in public health policy for older people with dementia, and also people with late-life depression, and for family carers or informal caregivers. So let's hear a bit more about this cross-border collaboration between municipalities on this theme. Mignon, over to you.
Okay, thank you. Thank you very much for the kind introduction. Yes, today I'm presenting the results of an assessment we performed in communities surrounding and including Maastricht, to see how ready they are for healthy aging. So as in the rest of the world, of course, also in your regions, we are facing the aging of societies. Now, how can communities learn from each other, especially in neighboring areas with similar demographics? Why not learn from each other's health policies and best practices? But what is already being done? Those best practices are often unknown to neighbors. So how can we help communities support the aging population more? Of course, the grass isn't always greener on the other side, but neither is it necessary to reinvent the wheel. Rather, one region can learn from another region and see what works there and what doesn't. This idea started blossoming at the 2010 health conference in the region Maas-Rhine and eventually resulted in the EU Prevent Senior Friendly Communities project. This project focuses on mental health, and it has 3 target groups: people with dementia, people with late life depression, and informal caregivers. On this map, you can see the region Maas-Rhine, with our research center in Maastricht quite in the middle. The green areas are Belgian regions, The blue one is Dutch or from the Netherlands, and the red region is German. Now, just to illustrate how close these areas actually are, you can see the narrowest part of the Netherlands, the blue part, and from there, it's just a 15-minute car drive from Germany through the Netherlands to the Belgian regions. So a good initiative to support healthy aging may be just around the corner, and perhaps even closer in a neighboring country than the next big city in their own country. So to see what was already being done in this region, we conducted an assessment in 32 participating communities, and we focused on municipalities, the local governments. We did one interview per municipality, but there could be several interviews present because we asked the municipalities to extend the invitation to other organizations and actors they deemed relevant to complement the answers they gave on the questions on the activities being done. This resulted in a total of over 100 participants in the interviews, from local policymakers to representatives of dementia organizations, or for example, representatives of care homes. We asked the municipalities about the policies and practical activities to support people with dementia, people with late life depression, and informal caregivers. We also assessed how the WHO pillars, health, participation, and security, were represented therein. These pillars are part of the WHO framework on active aging, which has been integrated into healthy aging. The interviewees were presented with a kind of self-assessment questionnaire of qualitative questions and quantitative questions to rate the extent to which target groups were addressed in policies and in activities. Our results were, first of all, that dementia is a much more salient theme in the municipalities than depression, with over half of the municipalities addressing dementia. Just a few municipalities say that they also address the theme of depression. However, there seems to be a lack of awareness that loneliness is also a risk factor for depression, and loneliness was more often addressed than just depression as a whole. Furthermore, the work of informal caregivers is very much appreciated by communities and deemed very important. But they also said informal caregivers or family caregivers are very difficult to identify, and hence they thought that existing support for informal caregivers doesn't actually always reach this group. Next, we found that there are more activities and support in practice than the themes are actually also embedded in policies. And when it came to the WHO pillars, participation came much more natural to the municipalities than the health and security. And they actually had some doubts as to what their task could be with regard to these pillars. Most of the communities also stated that they would be very interested in cross-border collaboration and not reinventing the wheel, but learning from their neighbors. But there were several difficulties in actually doing that, like time and money constraints, not being familiar with the health, political, or legal system of the neighbors, so they wouldn't know who to contact doing a similar job and to exchange with, and also the extra barrier of the different languages. Lastly, what was very striking was that this assessment actually turned out to function as a kind of intervention in itself, as it increased awareness in the municipalities not only on the themes of dementia, depression, and informal care, but also awareness of who in the community is working on what and how they can collaborate. Some communities reported the interview was the first time that some of these key players actually were sat together at a table and exchanged ideas, and they found this very fruitful. And although they did invite some of those key players, policymakers of the municipality were not always aware of what those organizations were doing and would therefore not always have been able to refer people in need of help to the right organizations. So to answer the research question, how prepared communities in the region Meuse-Rhine are for healthy aging, at the point of the assessment, they were already working on it, but could still improve on it. And what made it difficult for municipalities was that there were doubts as to what role a municipality can play in this regard and whether this should not rather be the task of medical professionals. However, we know now that we can support people with dementia and other target groups in communities as well. But one must take the context into account to understand the municipalities. not all of them have the time, money, or responsibilities to do so. When there is your region, responsibilities for integrating these policies can be found on a sliding scale from full responsibility by the municipalities in the Netherlands to, on the other hand of this scale, integrating these policies purely on a voluntary basis, as some German communities reported to us, and then Belgian communities were somewhere in between. What has become clear is that dementia has gained quite some awareness, whereas there's more knowledge to be gained on depression. Municipalities usually did have loneliness on their policy agenda, and loneliness is a large risk factor for depression. They actually underestimated how much they were addressing depression. Awareness, however, is not the same as a reduced stigma, so municipalities should also be careful not to overestimate how well the target groups are actually being supported, or how much stigma has been reduced, just because they have gotten more awareness of a theme such as dementia. So municipalities in the region Rhine are on their way to healthy aging, and we must take their political context, their capacities, their needs, and existing knowledge into account. This study provides first insights into what policies and best practices can be enhanced and exchanged to support healthy aging. But this project can also just serve as an example of a cross-border exchange in the field of public health to increase awareness and policies and activities. And although this project focuses on mental health policies and is applied in this region, it could also be applied to other themes or other regions. A post-assessment should give insights into if and how the project increased policies and support for all three target groups. So there were already quite some initiative towards healthy aging, especially regarding awareness and activities on dementia. Municipal policymakers were not always informed about the offering activities or organizations, and therefore not always able to refer people in need of those. We further found that there are more activities than there are policies on these themes. And we may hope that embedding such themes in policies can actually lead to more durability. But what I want you to remember most is, even though it may seem super obvious to us, the first steps towards more healthy aging and awareness can be as simple as just seating the right key players together at the same table. I want to thank my team very much, Professors Frans Verheij, Marjolein de Vught, and Ruud Kempe, and Dr. Maya Veenstra, and all the project partners. Please follow this link if you want to know more about the Senior Friendly Communities project, and please get in touch if you like. And thank you very much for your attention.
Oh, thank you so much, Mignon. Very interesting. And I think there were some themes that came up there similar to the previous session where, talking about it's not necessary to reinvent the wheel, as you put it. It's not because there are already things happening in different towns and countries that we can learn from, as we're learning from each other today. I was struck also by a finding you had where people with dementia who participated in the research also had a beneficial result for themselves. And I'm thinking about the public awareness campaigns we heard about earlier, and including people with dementia, which is so important to do. And knowing that for somebody with dementia or a family caregiver, when they participate in a research project, in a campaign, it can have benefit for them. Is there anything else you can tell us about that?
I'm not sure if I understand the question about whether people with dementia participated in our research. Is that the question?
Yeah, well, you were talking about just by participating, that there were benefits from the act of participating. I hope I understood that correctly.
Yes. Yes, thank you. That was actually rather the case for the policymakers and the people at the interviewees, because participating in this interview and having to answer all our questions made them realize, oh, we might actually have more than we at first estimated, or we overestimated what we're doing. And also they were kind of forced by us to invite other stakeholders to the table, and they had to sit together and exchange ideas. And some reported to us that they hadn't actually thought of doing that before, or they didn't know what this other actor was doing. So it was like, oh, your job actually complements mine. Maybe we should do this again. So that was very insightful.
Yeah, that's really interesting, isn't it? Because all that is talking to somebody else. And I'm reminded what Lorène said earlier on about bringing all the people in the different areas of France together, or in the supermarket in Denmark, when you talk to people, they realize actually they have skills and assets and ways that they can assist. So that's an interesting and very practical learning. Thank you very much, Mignon. We'll leave that there, and thank you for your presentation. And just to go back to the last one, we have somebody from South the Netherlands saying that there was already a campaign on brain health in south of the Netherlands, and some early positive results have been published. Marjolaine is saying that, and has some information there in the chat box for you to read. So thank you to all the presenters. We've gone a few minutes over time, and thank you to the hosts for allowing us to do that. But we really had great presentations, and I hope you all learned as much as I did and enjoyed them. So thank you to the presenters. Thank you to all of you for attending and for being excellent participants and chatting so much and asking so many questions and giving so many comments. And a reminder that you can contact any of our presenters through the conference platform or through the other direct ways that they showed in their slides if you want any further information. So we'll all stay in touch. So thank you so much for a lovely session. It was a pleasure to be here to guide you through today, and enjoy the rest of the day and tomorrow too. Thank you very much.
Thank you.
Thank you, Tina. Well done. Thank you.
Thank you.